Dr. Richard Bush, and we're going to do another installment on the American Chiropractor blog at theamericanchiropractor.com. Okay, the idea of today, and I'm sorry that I haven't been able to do a blog in recent weeks, but frankly, we've been very busy around here with a lot of different things, not only from treating patients, but also in dealing with expanding and making sure that my practice is continuing to grow, because I am in practice just like many of you. Now, I want to talk about something that I think is very important, and that is actually, first of all, making sure that we are focused predominantly on patient results. And the interesting thing in my own practice, we deal a lot with spinal decompression and dealing with non-surgical treatment of herniated and degenerative disc. And as a result of that, I'm always looking at making sure that I have the best possible outcomes with patients. Now, you and I both know, whenever we're working with patients, you can't have 100% success no matter how great your treatment is, or no matter how fantastic it is that you are at whatever technique it is. It can be diversified, it can be Gonstead, it can be Cox. In other cases, it may be something like adding decompression to treat those patients that, in a lot of cases, they just may be beyond what our abilities are from a just chiropractic standpoint to treat. We're always using the body's ability to heal itself, and the only limiting factor that we have is the body's ability to heal itself. But it goes back to what BJ and Dee Dee talked about, with the fact that 80% of the patients that we treat are going to get well. 10% are going to have miracles, and the other 10%, well, they may not get any results at all. In adding some of these other modalities and other treatments along with the practice that we have in regular everyday chiropractic, we're actually expanding our ability to treat those patients into that 10% that in some cases may not have responded, because we may need to use a little bit different type of a treatment technique. Now, as a chiropractor and as a focus on spinal decompression like I have in my office, there are times in the past that I've looked at different areas to make sure that we're solidifying and cementing and actually getting the best possible results we can in my practice, because that's what it's all about. It's all about results and getting the best results for your patients. So when in dealing with that, I've looked to different groups, different consulting groups, or different not even management style groups, but different people that are much like myself in practice on their own, and very often might have some different answers so that we can increase that ability to treat those patients beyond what we would be able to treat normally. And one of those people that I've worked with in the past is Dr. Loomis. I don't know if you're familiar with Dr. Loomis's enzymes at Chirozyme, but the amazing thing for me is that when we started using some of those enzymes, we were able to actually increase our success rate even that much more by getting better results, and by stabilizing those problems that may not have been stabilized or been able to be stabilized in the past. You know, that patient that has that chronic, loose pelvis, or the PI that they come in every week or every 2 weeks for an adjustment, or they came in to see you and they say, you know what, I've been seeing a chiropractor for years and I do great with it, but every 2 weeks I got this problem with my hips and it just seems like things slip out. Well, one of the things I found was if we treat them nutritionally properly, we can actually help them get better quicker and longer, so that the time in between visits may not be 2 weeks, it may be 4 or 6 weeks. And all of a sudden they think, man, I don't know what you've done differently, but it's fantastic, and I got to tell you what, you're a miracle worker compared to the other doctors that I've seen in the past. And that's something that not only makes us feel great about what we're doing, but it also improves the amount of people, or increases the amount of people that we treat. It improves our results, and it allows our practice to grow, because once you're helping people get beyond those limitations that they had or their physical body has had, by doing something as easy as making sure that you have the proper supplement to stabilize their pelvis, and this is something that we found is fantastic for that. So if you get a chance, take a look at Dr. Loomis's information, because I got to tell you what, he's got some fantastic supplements. His treatment protocols are great from a supplementation standpoint, and they work very, very well with what we're doing. And they've allowed me to get better results with the patients that we treat. You know, something else, I had heard a lot about oxygen. This is a pulse oximeter. I had heard a lot about oxygen, and I'd seen a lot of the different ads coming through for different types of treatment protocols involving oxygen. And one of the people that kept coming up was a guy named Dr. Michael Johnson up in Wisconsin. I think he's in Appleton, Wisconsin. As far as he's concerned, he's got a great treatment protocol that involves oxygen and the treatment of oxygen, and he looks at things more from a neurologic component. You know, the one amazing thing that I've seen is that oxygen does actually help the body heal, and it heals more, it helps the nervous system heal more quickly, and it calms down a lot of the different different aberrant problems that we deal with whenever we're dealing with patients that are in a lot of pain. So if you get a chance and you want to actually expand your practice and start looking at some of the different things from an oxygen standpoint, that's a good person to talk to. Okay? Now, something else that we have here, I also deal with curve restoration and correction and that type of thing. And I've seen through the course of time several different chiropractic neurologists in different groups. And one of the things that we worked with was head weighting. And it's kind of amazing to see how changing the way that a patient's curve and biomechanics are in relation to their weight bearing, how that can affect their life and can affect the amount of discomfort that they're in, and actually change their life because we're making permanent changes in their biomechanics. And so I've been through several different programs, seen several different treatment protocols, but the interesting thing about it, the people that I learned the most from were the people that were actually in practice. It's not something that's a theory. It's not something that, you know, hey, I learned this 20 years ago, but they're actually in practice. Those are the people that I found are the true, I don't even like the word guru. They're the true experts in treating patients that we see on an everyday-to-day basis. Because frankly, each and every day, each and every year, the patients that we see are different than the patients that were 10 years ago, 15 years ago, or even 20 years ago. They're continually changing because our physiology is changing. And along with that, our body's abilities to heal are changing. Okay? You know, something else that I've seen as a result of all the patients that we treat with herniated and degenerative disc problems is there's also an increasing need to be able to treat those patients that have different types of neuropathy types of problems. And so you know what I did? I started talking to some of the doctors that I've worked with in the past, and we started to find out that there are different groups out there that do neuropathy types of treatment. And one of the doctors that I saw was a guy out in Arizona. His name is Dr. Joe Doduro, and he works with, he's got a company that actually is national at this point. He's got an entire program that's the Neurologic Treatment Center, the Neuropathic Treatment Centers of America, which is the NeuroTCA. The neat thing about it is this is the type of thing that they use, and the neat thing about it is I'm seeing even better results based on the fact that these doctors are truly in practice. This isn't a situation where I decided, hey, I want to learn about something, and I went to somebody who, out of thin air, or you know, out of the ether, I think as they used to call it, decided, hey, this is a specialized treatment, and it's going to help these people. I've never seen a patient. I'm not really sure exactly what I'm doing, but it's going to help them. These are actually doctors that are in practice, and they do understand and they do know what it is that we're doing, and they're seeing results themselves. Why would I even take a look at all of this? Well, I take a look at all of these different areas because I'm in practice myself, and I want to make sure that I'm getting the best possible results for my patients. And that's something that I know that each and every one of you want to do as well. You know, I think it's very important to make sure that we not only take a look at the message, but we take a look at the messenger as well. And I think you're going to get a lot more from those doctors that are actually truly in practice than you are from just somebody out there who may or may not have been in practice and who's distilling things from different areas. So thank you very much. I want to thank you all for your time. I look forward to talking with you again here in the near future. If you have any questions, please feel free to email them to info@allcashpractice.com. And I'm Dr. Richard Bush. This is the American Chiropractor Magazine's blog, or the American Chiropractors Magazine's video blog at theamericanchiropractor.com. Thank you very much. Have a great day. If you have any questions, please feel free to email and or call at 888-471-4090. That's 888-471-4090. Thank you very much. Have a great day.